Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibility Man. We are committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Dr. Tamara Beckford. She is a board certified emergency room doctor and wellness expert. She's passionate about employee burnout and recovery. She is an internationally known speaker and consultant. She is an author, podcast host, and the founder and CEO of Your Caring Docs. Dr. Bedford, welcome to the show today.
Thank you for having me.
Look, I'm excited for this conversation. I got a ton of questions to ask you. But first, this programming note to our listeners and our viewers: follow, like, and share this podcast wherever you find it. Your support matters. It helps us attract guests like Dr. Beckford. Hey, I tell you what, we've been trying to get together now. We had to back out of one of them because you had other things going on. But I got a ton of questions to ask you, Dr. Beckford, and I want to start with you. When did you know that you wanted to pursue a career as a medical doctor?
Oh, great question. I think you can really attribute that to my father.
Oh,
So I had this very strong passion for the sciences as a young kid. And when I moved to the United States, because I'm originally from Jamaica, and when I moved to the United States, this passion really continued to reignite. And I moved here around 11 years of age, so a little shy of being 12. So now that's a junior high portion in life, right? And at first I said, he said, "Oh, you should try to, probably be a pharmacist." I said, "Okay." I mean, you had no true idea of the science professions, and this attributes to the power of exposure. So as I did a summer program in my local medical school, which in turn ended up being where I attended later on, I got the exposure to the career of a hospital pharmacist.
wow.
Unfortunately, at that time, they didn't know what to do with a teenager, 13, 14 years of age, has not been exposed to any of the deep sciences. So they put me in the basement to file paper in numerical order, the patient's um, medical charts. Now, if you have ever been a patient in a hospital, your medical record number is at least 11 numbers long. Imagine, and this is during the time of physical charts. So this wasn't computerized when you could just hit a button. So I was literally with the manila folders like this and trying to get all these numbers and get it in order. And I said, I don't know if this is what I want to do. I didn't get any exposure to people. And so the year later, I said, okay, I'm going to try again, but this time I'm going to apply to the doctors to see if I can shadow a doctor. And I did, and that was it.
Whoa.
That was it. I connected with it connected someplace in my heart and in my spirit. And I said, this is what I want to do. I get to talk to people, I get to help. And most importantly, I realized that I get to connect with other people. So after that light bulb went off, after that bug was bitten, it never stopped there. And that was around I'd say 1995, around 1995. Yeah. So
Wow.
from then on, I went full speed ahead
Uh-huh.
pursuing this thing called medicine.
Yeah. So it hit you in your mid-teens, the medical
Correct.
field.
Yeah. At that point, I was
Wow.
15.
That's
Mhm.
great. Yeah. What kind of student were you, did you have a public school education or was it something else?
So I had a private school education.
Uh-huh.
I went to a very small private school, and this is for high school in New Jersey. So for anyone who's in New Jersey who's listening, and you're in North Jersey in the Essex County area. I went to a small school called Mary Lawn of the Oranges
Mm.
Academy for Young Ladies. I cannot forget the last
Ah,
part. So my school was a very small school. It had a total of 160 students, which is all female. And my class had a whopping graduating class of 36. That's the entire graduating class. So I had the privilege of really getting an education where my class size was very small. So my particular section, I think there were like 12 to maybe 15 of us in that section. And what it fostered in me is, number one, there were a couple of reasons why my dad had me apply and, to go to that particular school. Number one, I was the only child at that time. So I was like, oh, yes. So everything was, all the zones of genius and everything was all dedicated to making sure that I succeeded. And he also wanted me to have a sense of inner strength, going to a school where I can get not just a great foundation academically, but also social skills, also skills of leadership. So those were all the things that were, going through his mind when I pick his brain and ask my dad about those times. So those are some of the reasons why I went in. So in high school, as you asked, what type of student, I was a student athlete. I played all the sports. I did all the activities. And I had a great time and fostered some great friendships for which I still hold dear now, many, many years later. My best friend and I were both doctors. We met the first day of high school, and, we're still friends to this day.
That's fantastic. When did, look, with a lot of conversations about the imposter syndrome, that kind of thing, when did you know you had the right stuff, to get this done?
Great question. Especially, back then, no one thought about imposter syndrome. There are a couple of things that as I do a reflection on the different phases of my life that I have noticed. One, my parents instilled in me the big fish in a small pond, and recognizing that when you move to a larger pond, you might be, like we say in Jamaica, the sprat, right? So you might start to be the smaller person in this larger community. And so with that, you had to realize that in order for you to rise back to the top, your environment has changed, and so you will need to adapt to that environment. So did I feel like I had the right stuff in undergrad? No. In undergrad, initially, I didn't do well during my first year in undergrad. And if anyone who's not familiar with the whole GPA, how it works in the United States, it's a weighted. So the earlier you do better, the better you are. I am one of those cream is going to rise to the top people. So I might not, kick it off, but in the end, it's going to be fireworks and sparks. So
I love the way
that's
you put that.
what occurred. But when you have challenges during transition periods, you start to question yourself. It's up to you to dig deep within and to learn from your past challenges that you have overcome. And so at a very early age, I started to learn and to follow along this trajectory that I had and recognize the pattern that I see in my life. If you notice, I said the cream is going to rise to the top. So I recognize, okay, I might not be kicking sparks right now, but just you watch and see. And so said, so done. By the time I hit grad school, I was a graduate commencement speaker because I had the top. So the cream was rising to the top. The fireworks were sparking. So I had to pull, and those same patterns will occur throughout every part in one's life. And so when I'm going through challenges, I will have portions of self-doubt, but it doesn't last.
Right.
Because I recognize the pattern.
Okay, many of us who are not medical doctors and many of your patients don't have a clue as to what a medical education is like. Can you just give us a peek into what was it like for you, your medical education?
Absolutely. So I'll give the formal portion and then some of the direct emotional and challenging parts of the medical education. So formally, you'll hear 4 years of undergrad. For me, I also did 2 years of grad school, so I do have a master's, and then 4 years of medical school. So within those 4 years of medical school, you have it's a little bit of a hybrid system where one, you're learning some of the clinical acumens of medicine, which is the last 2 years. That's when you hear people say, I'm rounding, I'm going on rounds, I'm in the hospital. The first 2 years are more of the science years. You're building on the basic sciences that you learned in your undergrad or throughout the different experiences to learn the nuance of how the body works from its different physiological portions. So you learn physiology, pharmacology, and all the ologies at that point, right? So when you hit the third and the fourth year, you're doing the rounding. So now you're getting to learn a little bit more, not just of the science, but also the art of medicine, which is just as important. So yes, I'm rounding on patients, but I'm learning how to speak and to communicate effectively with patients. I'm learning how to communicate joy and also pain, right? So there are times in medicine where I have to step in the room and tell you bad news. So how does one learn to deliver bad news? That's not something that just comes easily to everyone. So you learn those skill sets during those third and fourth year, in addition to learning how to gather data, how to interpret data in order to treat your patients effectively. After you graduate from medical school, you then go into your training portion, which is called residency. At that point, you've already decided what type of doctor, what specialist will I like to be. For me, I chose emergency medicine. So with my training in emergency medicine, which I did in Philadelphia, I did 3 years of that. Now, residency is one of the hardest parts of the entire medical process, because now you do have an MD, you are still learning, but you're also learning in a pace where it's a lot of hours. So a lot of information, a lot of responsibilities occur during that time. And you also are not earning a lot, but you're expected to do a lot. So emotionally, that takes its toll. Some people start their family during that part. Residencies, the least amount of years that this training process is 3 years, and it can go as high up till 7 years, depending on your specialty. Wow. So some of the specialties that are the longest, which is like a neurosurgeon, like they have 7 years of training after medical school. So when you see your neurosurgeons, you give them a handshake because they did it. And that's including taking a year off to do research. So that's the dynamic of what it takes to become a physician before you are now working, as we call, you probably hear people say attending, or working as a doctor in a community like I do.
So what, you said that emergency medicine is your specialty. Correct. What drew you to emergency medicine?
I got drawn to emergency medicine during my years in undergrad. So the same thing, I'm interested in something, I'm going to pursue, I'm going to try to get exposure. So we heard earlier my story when I said, okay, now I realized after shadowing a physician that I said, okay, I want to be a doctor. Now I had the opportunity to shadow different doctors. And when I shadowed this emergency physician in Newark, New Jersey, I mean, it just hit. This physician, she was actually pregnant at the time. And till this day, she doesn't realize the impact that she had on me. So I was just this little undergrad, very quiet and watching. And she said, yes, you can come and shadow me. And she was taking care of patients. She had residents that we talked about, training doctors who saw patients. They reported to her. She came up and she helped them to think things through as to how to train and to treat the patients. And everything was fascinating. From the outside, it was very chaotic. but I felt comfortable. And that made me realize, okay, this might be something that I'm interested in. However, I recognize that in medicine, when you make that decision for a specialty, 95% of the time you have to ensure that that's what you want, because it's not very easy to just change your mind. The way how the system is set, it's really like, okay, you've made this decision, now you're going to train in that path. So while in medical school, I kept a very open mind. I said, let me see if I do like this. I want to ensure that this is the specialty that I want to go into. And after rotating through the other specialties, it still clicked. Emergency medicine is it for me. There are aspects of it that really, of course, people hear the adrenaline and they're like, oh, you must like adrenaline. In some respects, yes. But what really draws me to emergency medicine is the ability to connect with the human spirit very quickly. When I open that curtain, when I knock on that door, I don't know what I'm stepping into. Someone can be having a very, very great day, or they could be having the worst day of their life. But I have to connect with you in that moment. And then I have to elicit your trust. And then I have to elicit your partnership. And that's what I love about emergency medicine.
As an outsider, and I'm sure that many people listening to this or watching this will feel the same way, I can only imagine that a Friday night or Saturday night, or perhaps
Sunday
any
nights
night,
too.
could be pretty messy in an emergency room. Tell us about that. What is that like being there in an emergency room, especially, Dr. Beckford, during a crisis?
Okay, so I'll give you the biggest crisis that we just went through, right? Okay. COVID. Let's talk about that. One of the challenge that happens when you're going through the crisis, on an average crisis day, it's a crisis outwardly prior to COVID. Our minds were trained to think systematically. So when someone comes in and they're having, let's say, a trauma, or let's say they're having a heart attack, there's certain, the team comes together, and then there's certain aspects that we just immediately start to run straight forward and get things done. From the outside, of course, it looks very chaotic. And outwardly, there are a lot of emotions. You're watching from the outside. You're not trained to do this. You're not trained to look for certain signs that we talked about, about the third and the fourth year where you're learning these art of medicine. But I am, right? So I step in, I'm assessing, I'm seeing what needs to be addressed and in what order that it needs to be addressed, right? So immediately when I run my list of patients, as an emergency medicine doctor, who is the sickest and who is not the sickest? Who came in and they were in the middle tier, but now they've moved to the top. Why? Because their vital signs have changed. Now their blood pressure has dropped as opposed to improving with the interventions that I gave, right? Now they're starting to have fever. Now they're bleeding. But wait a minute, you didn't come in bleeding, but now you're bleeding. So you're bleeding. So now you are the sickest. You're vomiting, but you're vomiting blood, or you're passing blood, from your rectum. Those are the things that goes through our mind. And you have also those who come in with breathing or respiratory issues. That's a lot of what we dealt with during the COVID period, right? So COVID was particularly traumatic for most physicians because we are used to dealing and handling with the onset of crisis, but in short bursts. I always say that, you'll have this rise and you said, ooh, that was a rough shift. I had blank amount of very sick patients. But the difference that occurred during COVID is that it never stopped. So you had the very sickest, and it was just onset of sick. And what's also challenging is emotionally, although we're trained to handle even just physiologically in bursts. And we're trained to handle maybe one person that you didn't expect to look or to have such a bad outcome, but not a ton of people, not a ton of 19-year-olds. 19-year-olds are not supposed to die from breathing problems. You know, you're 19, your body is at its fittest. And that's what was happening during COVID. Wow. You had young, healthy people whose oxygen levels were in the 50s. The normal oxygen should be at 100%. Why is your oxygen 52%? You know? And it was just a consistent young people. So when that happens, that takes its toll. And that took its toll on many of the healthcare workers. So that's where you find, the burnout that we'll probably talk about later. You'll find the onset of the emotional toll that occurred during the time of this COVID crisis.
Yeah. When you talked about that, it's just kind of reminded me of, I know it's different, but like a war zone, being in a war zone.
Exactly. No,
it's
not.
Going on.
It's not different. It was exactly what it was.
Yeah.
It was. And I'm glad that you say that, because that's what I likened it to also, in that I believe that the military, just like I'm trained to see a certain amount of sick patients, the military, they're trained to see, like you said, in the war zone. So they're trained in going and seeing 30, 40, 50 very, very sick people who have probably, been at a site that is just like a site that might have been blown up, or they're trained for that, so you're trained. But those in healthcare, especially here, your training was to see maybe 2 or 3. Imagine you're seeing 50 all the time.
Right.
And so you're correct. And that's what I likened it. I likened it to the military, where they have the training of the larger subset to be able to handle that. But we didn't. But we nonetheless were in that minefield.
Right. I'll tell you what. And we appreciate it too. But look, I'm going to ask you some specific questions and give me a flavor of, and you'll see where I'm going with this. So let's say you're in the ER, someone comes in crisis, something traumatic has happened. And they're in crisis when they come in. No one knows what's going to happen. The family's crazy, everybody's crazy. You work with them, you stabilize them, and they begin to show signs of recovery, and they're able to take to a room where they can later recover, eventually leave the hospital. What is that feeling like when you found someone in crisis, you're able to stabilize them and get them back on the road to health? What is that like for you?
It's a wonderful feeling to be able to, and it's a feeling of a lot of privilege and honor to be able to save someone's life, to turn their life around, to have them be able to connect and to reconnect with their family. Some people are getting second chances that we have no idea. We're doing our part, but there's something deeper that's happening within their family. We don't know what occurred before they entered the emergency department, but to play such a small but pivotal role, it's an honor. I'd say also, for those of us in emergency medicine, one of the key things that we also are unable to is to see the finished product. We do a lot of work, but we don't get to see how a lot of our patients turn out. And when we do have families reach back out and say, hey, by the way, remember me, because we'll remember some of those very pivotal moments. This is what's going on with me. I tell you, the joy that's inside, it'll give you goosebumps. And that has happened to me. And actually have a family member made a certificate plaque for me. Wow. And it was maybe like a year and a half later, I was at work and one of the security guards says, hey, someone left a package for you here, there. So I looked at it and it came from this family. And I
Mm.
distinctly remember the story, what happened with that family. It
Mm.
was and I said, wow, most of the time, the last doctor that takes care of them gets the thank you, because
Mm.
they see that person on a more consistent basis. I'm the first person that you
Yeah.
see. So by the time you're on day 37 in the hospital, you don't remember the person who took care of
Mm.
you when you were altered or confused, or
Right.
the person that came to pull up some of the diagnoses. So when that family pulled together and said we wanted everyone who was on the team taking care of our loved ones. We want to send them a
Yeah.
thank you. It was incredible.
Right.
And I actually got to see the family again a year later from receiving that plaque. And as soon as
Mm.
I stepped in, they all looked at me and they said, you're the one who saved our dad. And I said,
Mm.
oh my gosh, yes. And I remember
Mm.
everything. I remember the room. I remember where I took care of them. And
Mm.
it was such a joyous reunion because he
Mm.
was doing so much better at that
Yeah.
time during this reunion in the emergency department.
Right. So I'm going to probe that just a little more. You've already mentioned saving a life because I wanted to ask you,
Sure.
what is it like, to save somebody's life? But I want to probe it a little deeper.
Mm-hmm.
Let's say that someone comes in with a heart attack,
Yes.
and how do you, firstly, two parts of this question. How do
Mm-hmm.
you know which medication could help this person? And then what is it like when you know that, look, if you did not show up, that this person would not have made it? How do you know
Mm.
what to give? And then secondly, when you know, yes, I saved that life.
Mm-hmm.
What is it like?
Absolutely. So with the heart attacks, most heart attacks occur because there's a blockage, there's a blood flow. So when we think of the heart has two parts to it. There's a mechanical and then there's an electrical system. So that's how wonderfully made we are, right?
Yeah.
So we have an electrical and a mechanical system. With the mechanical, we need the flow of blood to the heart. Why? Because blood has nutrients and it has this especially important thing called oxygen, which all of our
Right.
tissues need. So when someone's having a heart attack, the majority of the time, there is a lack of blood flow to that particular part of the heart. When the blood decreases in the flow, the person starts to feel pain. Less
Mm.
and less blood gets there, that's the harder the pain is.
Mm.
So when they're coming in with a heart attack, that we use the electrical system to give us an idea, and that's where you're having the EKG, electrocardiogram, because it's showing us on the electrical system, say, hey, there's decreased blood flow, plus the patient's coming in with, let's say they're having the typical symptoms where it's just a hand, fist clenched to the chest, they're
Mm.
pale, they're sweaty, there's decreased blood flow. So your job is to reverse the flow of blood,
Mm.
especially in time to get them to the cath lab where the cardiologist can put either a stent, which is a device to keep the pipe open so the blood can continue to flow. So in the
Yeah.
emergency department, if you are unable to get the doctor, if you're in an area where you don't have the cardiologist there in a short period of time, then you are decreasing that blood flow with blood thinners. So that's what we call the
Mm-hmm.
lytics.
Mm-hmm.
So what is the goal of that? There's a plaque or there's something blocking it. We need to dissolve whatever is
Mm.
blocking that flow so that we can
Uh-huh.
have the flow go to that particular
Oh,
part of the heart. So
okay.
that's what you think about when you're coming in and you're saying, okay, depending on which area, this is what I need to do. I need to do it quickly. I need to get them to a point where they can get, I'm the master stabilizer. That's what I do as an ER doc. So I can get them off to the specialist who will do the definitive or the final treatment in order to reverse whatever condition that brought them in there.
Well, it sounds like just a challenging job to have, doctor. I mean, because there's so many different things that gets thrown at you. But
Mm-hmm.
you're a very busy doctor. You also founded Your Caring Docs, and just for those listening or watching, and she
Mm-hmm.
spells
Mm-hmm.
you are Caring Docs. Why did you establish this organization? or this?
Absolutely. Thank you for asking that question. So I started Your Caring Docs in during the pandemic. So
Mm,
ironically, during that time, prior to the pandemic, I had gone through some periods where I recognized I love medicine, but then I realized I don't think that that is the only contribution that I've been placed on this earth to do. I
wow.
actually am placed to contribute more to society, to my fellow people. And I
Mm,
went on a period of self discovery. How can I do this? How can I contribute more? I know some people might be thinking, like, what do you mean? You're doing it as an ER doc. Yes,
yeah.
but at this point in time, at that point, I was like over 10 years of working in the ER. And I felt that my skill sets included more to give. So, as I went through a period of self discovery, what is it that I can do? Then I decided to start Your Caring Docs. It initially started out as a telemedicine company, but then I said, no, I'm not going to best serve my people by doing telemedicine. So I brought it to the point where I can help organizations and companies to decrease their employees' stress and burnout through
Mm,
self-care strategies. So I
mm,
do that because I've recognized that working consistently and working hard, people were starting to burn out. And
mhm,
burnout was happening everywhere. It happened during the pandemic to those in healthcare. It
mhm.
happened to those who are not in healthcare. Private practice owners, they were losing their practices. There are just so many things that were happening to people. So I said, okay, if I can highlight what burnout looks like, if
Mm,
we can use some of these strategies, because although one would have thought that I, as an emergency medicine doctor, was
mhm.
going through burnout during the pandemic, you'd have been wrong if you put a bet on that. I was thriving during the pandemic.
Wow. Ooh,
It was
that's
the
mhm,
opposite of what should have happened.
mhm,
And
mhm,
why did that happen? So I had to question myself, why am I thriving right now? And two, what are some of the steps that I've done? And three, I can't hold this to myself. I need to share this. I said that this whole period of discovery was to be able to
mhm.
share and to help those around me with the skills that I've learned. And
Yeah.
that's where Your Caring Docs came in. I
Okay. And this is
recognize
so
that,
important. Yeah.
yeah.
This is so important.
So I
Now, and I want
recognize that,
to, yeah.
hmm,
Mhm. Yeah. I want to pause here for just a second because
absolutely.
you've thrown out some things that are so important here to make sure that
Mhm.
everyone listening or watching gets this. Now, you're still working as an emergency room doctor, so right?
Correct. Correct.
You started Your Caring Docs. Now, as an emergency room doctor, about how
Mhm.
many hours do you work per day
As an
on
ER doc,
average? Yeah, is an
yeah,
ER
as
doc.
an
Yeah.
on average, I work around maybe 10 to 12 hours if we're
Mhm.
including finishing up charts and so on. With
Sure.
active clinical time
Mhm.
around like 9 to 10
Yeah.
hours
Okay.
of like
Okay. So,
consistent
so
clinical.
we can say that you, on a weekly basis, maybe 50 to 60 hours a week as a ER doc.
As an ER doc per week, no. I had to
Okay.
reduce that.
Okay.
As
Okay.
an ER doc per week, I'd say closer to 40.
Okay. That's great. Ooh, that's really short. Now, but in addition to this busy life, professional life of yours,
Mhm.
you launched Your Caring Docs. I mean, that's where do you get time to sleep, Dr. Beckford?
One of the great honors is recognizing that sleep is important. And part of what one can help to reduce and burnout
Yeah.
and stress that you have in your life is to rally the support of those around you. I know
Mhm.
that a lot of people, and I remember even watching one of your prior interviews, you had a someone who was on who said that when she was going through some of the toughest periods of her life, when she was going through a divorce after being married for almost 18 years, that she didn't tell anyone. So she kept a lot of that to herself.
Mhm.
So during this period, I rallied and I got support. My family supports me.
Okay.
There, I have two young kids. When I started this, my youngest son was a year and a half. The other
Mhm.
was 3 years old. we're in the pandemic. There's no way that I can do that by myself. I
I
had to,
got
one,
you.
recognize,
Mhm.
accept help,
Okay.
get a
Mm,
supportive community that is rallying in the
mm,
direction where I'm going. I recognize
mm,
that I am no longer the person that I was 5 years prior. Why? Because my mind is set in a different direction.
mhm.
So if I
Okay.
want to achieve the goals, then I have to be able to bring those around me and surround myself with people who
Mhm,
are like-minded. So I did
mhm.
that. So I tapped into support. I tapped into a community of like-minded people who were
Right.
going in the direction where I'm going, which is like, I believe that I am made for more. That was the
Mm.
community says, okay, I'm
Wow.
a doctor,
Mm,
but I could do more. And so
mm,
we all are there pushing ourselves to be able to contribute to society in other
mm.
ways in addition to medicine.
That's impressive. That's impressive. I want to put the spotlight now. You've already opened the door, but I want to put the
Mhm.
spotlight on burnout. Firstly, what is it? What is burnout?
I am so glad you asked that. So, burnout is a physiological response within our body to chronic stress, especially in the workplace. I know
Mm,
now I see the definition is changing, saying that burnout is not only in the workplace. Burnout traditionally is workplace oriented, but it does spill over into one's personal life. I attribute burnout to the three Ds, the definition of it. So the first D is depletion. So you have emotional exhaustion that occurs. The second D is detachment. You start to get depersonalized with your job. You're no longer feeling that drive that you initially had, that feeling as if you are. And then the third is really a decreased sense of accomplishment. So you don't feel like you're contributing well, even though you're not feeling that sense of accomplishment in the work that you're putting out there. And
mm,
burnouts accumulatively, that's burnout. Those three things, the three Ds, the depersonalization, or depletion, the detachment, and the decreased sense of accomplishment in your
mm,
work. Now, the challenge with burnout is that it's a phase, so it's not a night and day, right?
mm,
And through the phases, which are actually 5 phases of burnout. So when one starts a job, you're going through, initially it's the honeymoon phase. And that's when you're
mm,
feeling that sense of accomplishment. What I do matter. Oh, this is great. I am having such a great impact on people's lives. I'm
mm,
having an impact on this job. I matter to the team, and I can see how I am having an impact on the team. Then you have the acute stress portion
mm,
where you're starting to feel a little bit of stress. You might have a little irritability here and there, but you're able to manage it. You might see a little bit of mood change, but it's not that much. Then you start the
mm,
chronic stress phase. With chronic stress phases, you are starting to have some of those symptoms where your body physically is starting to have like the chronic headache that you just can't, this belly pain that just won't go away. You've gotten it
mm,
evaluated and there's nothing quote unquote wrong. You're
mm,
having the headaches, the belly pain. You're starting to notice that you're being more and more irritable because now you're under chronic stress. When you've gotten to burnout, which is the fourth phase, that's where you're hearing the depletion, where you're just giving it is what it is. And I'm like, oh,
mm,
you're doing such a great job. Yeah, yeah, it is
mm,
what it is. Hey, would you like to connect with us? No, you're no
mm,
longer feeling a sense of accomplishment. You're just emotionally exhausted. You can't get out of bed. When you do, you're in front of the building and you're gearing yourself up. You're having to give yourself a pep talk every
mm,
single day to get out of the car, to get into the building, to log on. You just start
mm.
to feel just emotionally just exhausted. The
Yeah.
fifth phase is the worst phase, and that's the crisis phase.
Mm,
That one mimics those who are having mental health challenges, such as
mm,
depression and anxiety. And
mm,
with that, when that occurs, a lot of people get to the point where they're feeling so depressed that they feel like they want to end their life. And that's why it's so important for us to address burnout, to recognize the signs, the symptoms of burnout in our team members, in our colleagues, in those who we lead, so that we can reverse or intervene and not have someone get to that point.
So this just gets me thinking here. So, I mean, but no one can be responsible for self-diagnosing, even though we are responsible for ourselves. So, but who gets to help us recognize that we have fallen into that state called burnout?
When one is in burnout, of course, you recognize within yourself, there's some times, and what's important is recognizing the phases so that you can see the pattern, so you can prevent that next phase. If you, however, have fallen into that phase without you recognizing it, it will be recognizable at your job. Why? The quality of your work starts to suffer. If you were prior a person who delivered top-notch results, top-notch work, but now your work quality has decreased, you are now constantly taking time off, you're either late, a lot of absenteeism is occurring, and you're absent not because you are feeling physically ill, like say, okay, I caught a flu, then I need to rest, but you're calling out sick consistently because you can't get yourself out of bed.
You know, this is so important. What you just told me, what I hear you say to me is, look, there are two areas of responsibility here. One, of course, you're responsible for yourself. We always are. But in addition to this, you're saying, at least the way I hit it, if I got it wrong, let me know, is that, you know, managers and leaders also have a responsibility to their employees.
Correct.
And they too should be positioned to spot conditions like burnout. Is that about what you're suggesting to us?
Absolutely. Absolutely. Because once you can spot it, then you can do an intervention, right? And the intervention is life-changing, this intervention. And it's not only life-changing, yes, it also is beneficial to the company. Because now replacing an employee, it's very, very expensive. Replacing that mind, the trust, the information that person and that person contributes to the team, that's expensive. If you can help that person by intervening wellness programs, that's what they're there for. Workshops in recognizing signs of stress, in recognizing and intervening with stress management, that's what it's there for. But a lot of people, they don't recognize the different phases until it's too late. But when you are there as the leader, you will see the signs. You can train them on that.
I'm glad you're working with leaders, because I think, you know, managers and even CEOs need to be aware that they're responsible for their not only production, but also for the well-being of the employees. You know, I heard you talk about, or might have seen your blog, I don't know, but you talked about, let me see if I can get this right, the burnout factory. How do you know if your company is a burnout factory? What was that about, Dr. Beckford? How do you know if your company is a burnout factory?
Well, you'll see with the burnout factory, if you're having these, like we said, the signs and the symptoms, I know you're dealing with someone who's a doctor, so we're looking from the outside, right? If you're seeing this increased absenteeism, if you're seeing the productivity has changed, if you're noticing that your team, the morale has completely changed, then you know that you have not hit that pulse as to what's going on in your company, right? And we mentioned that there are usually some small but powerful ways that you can intervene. yes, on the larger scale is providing workshops, training on what to recognize as a part of stress, burnout prevention. But in the smaller scale, it's tapping into those one-on-one with your team, tapping into that one-on-one with your employees. It's more than the hi, how are you doing? Because the automatic response is, I'm good or I'm fine. Well, do that
And
follow.
we lie about that, don't we?
Absolutely.
Yeah.
99.9% of the
Yeah.
time.
But Dr. Beckford, I just thinking about this because you are helping society really evolve in the way we work with people. If you look at this country, 1800 is a little different than the early 20th century, early 20th century, a little different. But the old way of employer-employee relations is suck it up, tough it out.
Yes.
What's wrong with you? You can't hack it. But you're telling managers and leaders that there's another way of approaching this. So continue to tell us about this other way of looking at an employee who may be struggling with something. We're going to label it burnout.
Yeah, absolutely. So, the what's so important about these interventions, like we said, going the next step, how can I support you? Do you have everything that you need? Recognizing where are they aligned with their skill sets? Is it aligned with the job or that they're currently doing, right? So when you tap into all of this, what you are doing is not only helping to avert some of these stress, burnouts, but you're also contributing to the longevity of that employee in that company.
That's for sure. And in effect helps, and that helps the company continue to prosper as well. Yeah.
Absolutely.
Okay, so look, burnout is important. Dr. Beckford is the expert looker up. Now, you've written about this, haven't you?
Correct.
Okay, so tell us about, and you've worked with other writers on this subject as well.
Correct. Yes.
So tell us, how can we find your book?
So the book is on Amazon. It's called Thriving After Burnout. And it's my story, a little bit of my story, in addition to a collection of stories from other physicians who have gone through far worse than what I have gone through in regards to burnout in different aspects of their lives. For some people, it was during training. For others, it was during personal portions of their lives. For me, when I recognized in retrospect, because at that time burnout wasn't really talked about, was during the first 5 years after my training, where I worked as an ER doctor, fresh out of training, working at the maximum. Now, during that time, I worked way more hours than I did now. And I was at a different hospital system than where I currently work. And I saw the signs and symptoms of burnout. And for me, my mood changed. It's interesting. I sometimes wonder if people, because I smile so much, I have a very jovial personality, irrespective of the fact that I work in the emergency room. I see some of the worst things. When I step in, I'm stepping in with a mood of calm, a mood of uplifting. That's my natural personality. When I'm talking about even this thing as serious as burnout, I still have a smile on my face. Why? Because I believe how I can, my educating others will help to change the circumstance. So we're uplifting someone in the end. So I recognized that I was at burnout when this smile left. I was carrying home my burden, and I never did that prior. My husband, he said, "You're always sad and cranky and angry." And that's not my natural personality. And so I had to look back, well, what is happening? And there were just a lot of stressors that was occurring during that time. My mood changed. The same thing that we talk about, sitting in the car, having to pep talk yourself to get in. I had to do that. Every time it was time for me to go to work, my mood dropped. I couldn't wait until everything ended so I can come back, so I cannot be in that environment. This is something that I trained to do. You heard my stories. I loved doing medicine. I mean, this is something that I thrived and I worked at since 1995. How is it that I no longer wanted that? Is it that I didn't want to do medicine? No, it's just that environment was not the right one for me. So that's how I knew I was burnt out.
I mean, I tell you, and I hope that people listening or watching will really get this. A couple of things firstly, you began to recognize some, let's call them symptoms in yourself. But what I also heard, and I think this is beautiful, is that your husband recognized that something was going on with you as well. Absolutely. Which enabled you to. I mean, that's so important, because I'm from an older generation. It's like, forget you, figure it out yourself. But you're talking something else. So you're big on self-care. You've also already told us about that, and I wish I'd caught it and underscored when you said it. You said one of the things that you do to care for yourself is you enjoy reading scripture. Even start your day with it. So talk to us about self-care. What can we do to take better care of ourselves, Dr. Beckford? It sounds better when it comes from a doctor. So I want the doctor to tell us, how can we take better care of ourselves?
I love it. Thank you. Yes, I'll put on the doctor hat again for this portion. And I'll start off with some personalized stories. During the time of, my chaos, I didn't have what I called a wake-up routine. When I started to invest in the personal development that I told you about prior to COVID, one of that was in waking up. I started to read the Bible. I was curious, and that's my personal spirituality. For those of you who aren't spiritual in that respect, your time might be due to meditation in a different way, but that's my time. And as I continued that, I recognized the first thing that I need to do when I wake up is not pull my phone out and start looking at social media. My day changes dramatically when I started that way. When I invest in myself, in my mind, before I use my mind to do other things, such as enter into the day, my day changes dramatically. I'll give an example. First thing, I used to be a snooze queen. So snooze button, snooze, snooze, snooze. And then I learned So I, learned that, hey, 5, 4, 3, 2, 1, let's get up and go. Okay, how can I do this? How can I change this? My phone was right beside my bed. If my phone is right beside my bed, as soon as it goes off, I can swipe and go right back to sleep. So the first thing is I put the phone across the room. So now I have to get up to turn off the alarm. That change alone, powerful. Because now no longer, once I get up, then my body's like, well, you're up. I'm like, oh, wow, you are right. Now it's time to do the next thing.
Pretty good. That's pretty good.
So the next thing was investing in my mind. So what am I going to invest before my day starts? Am I going to listen to all the woes, and am I going to look at all the things that should, the things I have no control over? Bombard myself with negative news, negative information, or am I going to uplift myself with either spiritual upliftment, positive affirmations, those who are pouring positive information into me? I choose the latter. And that's what I did. So now I have 2 things that I've done during that time. After that, and this can take probably 10 minutes. You're brushing your teeth, you can listen to positive information, affirmations, uplifting stories, ways to improve your life. the Jim Rohns. Like I'm listening to Jim Rohn again. I love him.
Mm.
Listen to his
Yeah, he's great. He is.
yeah, absolutely. So,
Yeah.
I listened to it back then and I'm listening to him again now. So those are positive ways to input information. Now, once I have done that, do you think you're going to be able to get me off my kilter?
Mm.
No. Why?
Yeah, I
I've
love it.
already invested in myself.
Yeah, I love it, Dr. Beckford. That's awesome. Okay, we got a blueprint, folks. We got a blueprint. Self-care from Dr. Beckford. Look, our time is almost up, but I want to, you're all over social media. In fact, I would say you are a LinkedIn guru. And they rewarded you with a LinkedIn's, is it a top voice recognition? Tell
Correct.
us about that. What is that? Tell us about a little bit about that.
So yeah, the LinkedIn Top Voice, we have Top Voice in leadership. We have a
Uh-huh.
top some badges, and we have
Okay.
the LinkedIn Top Voice and Employee Engagement badge. So recently, LinkedIn gave us the honor, a couple of us who have these badges, to come to their headquarters, and that's one
Hmm.
of the reasons why we were actually supposed to connect earlier. Like we said, we've been trying to do that, and it just so happened that we got invited to their headquarters in Chicago for those of us who were LinkedIn Top Voices, where we did some brainstorming with LinkedIn about where the direction that they would like to go, the
Hmm.
information that they love getting from those of us who produce content for LinkedIn. Um, so I'll tell you guys the secret. Continue producing content. That's what they said.
Okay.
And
Well,
they love valuable content, stories that not only inform, but also gives a personal perspective on how you
mm,
are able to overcome your challenges. So for those of you
mm,
who like to write for LinkedIn, in their different communities. So those were some of the insights that they provided. And then we got a couple little swag gifts for
mm,
taking that
mm.
trip out to Chicago. So it
All
was
right.
pretty fun.
Well, look, I enjoy reading your posts on LinkedIn. You are a machine, when it comes to that. And by the way, good stuff. I mean,
Thank you.
really good stuff that helps a person grow. One last thing, I had no idea that you were so transparent. Many of
Yeah.
us professionals are like, we want to be bulletproof, But when did you come to that? You're a well-trained doctor, board certified, but yet you give us a glimpse into your life. When did you come to that?
That's a great question. I think that happened in 2020. I can distinctly remember as a part of I was a part of and am still a part of a community of where I am in a coaching program. And I was challenged to put a video out on social media. And this was August of 2020. And I said, oh my goodness. The video was around 2.5 minutes long. I don't think, I think I held my breath the entire time.
Mm.
But that was the start of what you guys are seeing now. Me being on
Wow.
social media consistently, being able to talk. So once I got over a little bit of those fears, and I
Uh-huh.
got over, I think like in Jamaica we'll say my shame tree dry up. So I no longer was afraid of what someone would think about me. Why? Because if
Mm.
I'm worried about me, then I'm doing the opposite of what I'm been put out there to do, which is to
Yeah.
help others. So
Yeah.
there's someone else out there who wants to go out and to talk, but feel a little bit inclined that maybe this isn't professional to do so.
Yeah. Yeah.
Yes, if you are helping someone else with your story, then yeah, as long as you're comfortable, whatever you're comfortable revealing, and if it supports and it helps others, then you do it.
Mm.
Um, I know that I'm a professional, right? I know who
Yeah.
I
Yeah.
am. I know the training that I have. I know the person who I am inside. So at this point in time, I'm confident enough to
Yeah, that's
handle
great.
that. Yeah.
And I'm glad you're doing it. I'm glad you're doing it. One last thing, on top of all of this, you are a dynamic, engaging podcast host. What's the name of your podcast and what type of content do you try to put out with it?
Absolutely. So my podcast is named after me. So it's the Dr. Tamara Beckford Show. And with that, I get to engage with my fellow physicians who are doing amazing things inside and outside of clinical medicine. And I tap into their stories. I tap into their background. I tap into why they're doing what they're doing and also what challenges they've overcome with burnouts. Because believe it or not, and this is one of the things I want to say to someone who's going through burnout at this time, you're not alone. Many of us have gone through it. So I always love tapping into the story of finding out what someone looked like. What did burnout look like for you? And what are you doing right now to try to prevent yourself from getting back into that phase?
Oh, that's awesome. Well, look here, keep doing what you're doing. Dr. Beckford, it has been a pleasure sitting and talking with you today. Thank you so much.
Thank you for having me.
You've been listening to the Possibility Action Network podcast. Our guest today has been Dr. Tamara Beckford. I'm your host, Stephen Middleton. Until next time, good day